Hello and welcome to our April 9th Veterans Town Hall. First, I would like to share some information about our main hospital, including commonly requested phone numbers on your screen. What you see here is our ways where you can communicate with our facility, whether it's for scheduling an appointment, reaching out to your local mental health clinic, My Healthy Vet inquiries, patient advocacy questions, medical records, and enrollment. So feel free, if there's any numbers that you think you need, please utilize them. We will happily assist you. Today's Veterans Town Hall also highlights our Joliet CBOC. Joliet serves approximately 250 veterans daily and provides a range of services, including optometry, podiatry, primary care, telehealth, mental health, and specialized care for female veterans. Additionally, this clinic offers weekly chaplain services for veterans and their families every Friday at 1 p.m. or by appointment, and on-site veteran computer lab and a micro food pantry. A big initiative for the CBOC is construction to improve the facility, which is slated to be completed in September 2026. The Joliet CBOC contact information is on your screen. If you have any questions, please comment below or send us a Facebook message. We will get back to you as soon as possible. So for additional news, starting on April 11th, our COVID-19 fort located in the Indiana lot east of Building 228 will close to accommodate more parking for Hines employees returning back to the office. It is important to note, however, that testing is not going away. Please contact your primary care provider to coordinate COVID-19 testing. At this time, we will now have our safety story from HRO, Mr. Kaizo Beck.
Thank you, Ms. Morris. And good evening, everyone. Our safety story today is about a Hines engineering staff who showed a proactive approach in preventing injuries on campus. During inspection rounds this past winter, a Hines maintenance inspector identified several areas outside of Building 217 and 221 that needed the red rubber slip mats replaced on the sidewalk areas. In several areas, they were either missing or needed to be repaired. These mats are usually in key areas such as hills or leading up to a road that become a greater slip hazard. The challenge presented were to get the mats reordered and the coordination needed with the building shop to get installed. The Hines inspector took it upon himself to get the mats replaced in a timely manner. He coordinated the efforts with the supply chain office and the building shop to get the mats properly installed. The impact of the mats being installed was immediately recognized by both staff and the veterans. No longer were mats becoming a trip hazard. The installation in the areas they were missing helped alleviate future tripping or fall hazards. This story falls under the HRO principle of preoccupation with failure, anticipate risk. The Hines maintenance inspector took it upon himself to be a proactive, and instead of walking around the mats or stepping over it, he looked at the big picture of having new ones put in place and get others repaired. What others could learn from this story is to let someone know if a potential risk or fall could be prevented. Sometimes something simple such as a little crack or a raised surface could be repaired or replaced before someone suffers a serious injury during a fall. This concludes our safety story. I will now introduce Dr. Richardson for medical updates.
Thank you very much, and thank you for joining us tonight on our Veterans Town Hall. The issue that I wanted to update everyone on is the changes that are occurring with our management of the COVID infections and possible infections. Up until now, I think everyone recognizes that there has been a separate fort on our campus that will do COVID testing for veterans who require testing for a pre-procedure or for some other instance like that. As of Friday, that fort will be taken down and will no longer be needed because COVID, although continuing, COVID testing is not necessarily required. In the interim, if a veteran needs COVID testing because of a pre-procedure requirement, then certainly it will be done in the emergency room at the moment and scheduled in that way. Other than that, if there is just a random need, there will not be a fort testing for out on our campus. Employees, we will have slightly different reasons. Certainly, if there's an outbreak, there is going to be COVID testing done by the occupational health and by the unit, and that will be different for employees. The other thing that will change because of that is from guidance will come that masking in most instances will now be optional. The requirement for a mask will only be in those areas, the transplant unit, the dialysis, and in areas where chemotherapy is being given, so on the oncology chemotherapy floors. The masking required for long-term care, again, will be dependent upon whether there is outbreak continuing in long-term care or whether there is a patient that needs special precautions, and obviously the nurses and the attendings for that individual patient will be done. But the requirement for mandatory masking in most areas will now be lifted, and look towards the changes that will occur in terms of our signage, and also some of what I'm saying will also be up by the end of this week on our SharePoint or on our internet site. So look there. The second thing I wanted to update everyone on was our continuing changes coming in terms of the executive orders that come down about eligible veterans and what we can and what is allowed and what's not allowed. I want to say that we will continue to treat all veterans for all medical cares with respect as we have always done. The changes that have been asked are changes merely to our employees and to some of our signage and things like that. But in terms of being able to come and receive medical care in the most part, please get in touch with your physician, get in touch with your primary care doctors. We will continue to do all appropriate medical care. So thank you all very much for allowing us still to provide care for you. And now I'm going to ask Ms. Candice West and Carol George to come and speak about some of the changes in our nutrition services.
Hello, thank you, Dr. Richardson. As Dr. Richardson said, my name is Carol George and I manage nutrition and food here at Hines. And there are many changes happening in the department for both acute care and long-term care. I will start with acute care, building 200, and room service. Currently, when you're admitted to the hospital, the provider orders you a diet and you are sent a meal. Beginning this summer, when you are admitted, the provider will continue to write your diet order, but you will be able to call the kitchen and order what you would like to eat. Just like you're at a fancy hotel, you'll be able to call down and order food when you want it. You will dial the number, order your food when you're ready to eat. As a patient, you will be able to order 6 times a day, breakfast, lunch, dinner, and 3 snacks. Once the order is placed, Nutrition and Food has 45 minutes to have your food delivered. If you are admitted to long-term care, or the CLC, you will be afforded the same menu items. However, because the distance from the main kitchen is far, we will be able to prepare the food, prep the food in the main kitchen, send it to the kitchen in 217, and prepare it there for a nice hot meal for the veterans that live in the CLC. They will be visited by an ambassador from Nutrition and Food the day before to get their menu selections for today. So that's also a big step for us in Nutrition and Food to give the veterans the selections that they would like to have. These items, I already said they'll be prepped in the main kitchen. So with this change comes a lot of other changes. We're gonna have new delivery carts that will keep one side hot, one side cold for better temperature control. We're getting all new trays, plates, cups. You'll be able to see all these changes when you're admitted starting this summer. This has been a goal of Nutrition and Food for quite some time. I've been here for 3 years. It's been a goal of mine, so it takes time to make these big changes. But I am excited to see these changes for the staff that work in Nutrition and Food, but mainly for you, our veterans that we serve here at Hines. We look forward to serving you in a new way this summer. Thank you very much. Up next is the Diabetes Accreditation Clinic, Ambika Ambly and Tim Burke.
Good afternoon. My name is Dr. Ambly. I'm the Section Chief of Diabetes and Endocrinology. Thank you for the opportunity to give you an update on diabetes education here. Diabetes self-management education and support is very crucial for patients with diabetes. There's several benefits, including improved health control, outcomes are better, there's reduction in glycemic goals, A1C gets better, blood pressure gets better, cholesterol gets better. In addition, they also have psychological benefits. We empower them, they become more self-efficient, and there's also a reduction in healthcare costs. Now, when the diabetes education has certain programs involved in it or certain components, we are eligible to get accreditation from the American Diabetes Association, which is considered the hallmark of excellence. And as our diabetes education has met all those standards, we received the ADA accreditation in March. This time I want to introduce Tim Burke, who has been the face of diabetes education here for more than 30 years. He'll sort of lead you through what you can order through in the CPRS.
Thank you, Dr. Apley. So I'm just going to go through the latest ADA DOD certified outpatient diabetes education consult. It's now available in the CPRS. Key details are patients can be scheduled either as groups or individuals, in person or as a VBC, and in some cases, if necessary, by phone if the patient is not able to come in or do a VBC. There's a link in the consult, and the main link for ordering the consult is the Hines Phone ADA Evaluation Clinic. This will be the main link for 90% of the consults, and it clicks and notifies the diabetes nurse to call the patient and do a phone survey or interview with the patient to evaluate them, where they are with their diabetes and what their education needs are. And so with the veteran, the nurse together, they can put them into the classes that are necessary for them to improve their diabetes. The multidisciplinary modules that are available to the patient, there's 8 altogether, and they include nursing, nutrition, pharmacy, physical therapy, and mental health. The additional consults that are available, have been available in the past, are for prediabetes, a healthy living class, includes those who have also an A1C between 5.7 and 6.4 for prediabetes, hypertension, and hyperlipidemia, and obesity. These folks can be scheduled into the prediabetes healthy living class, and that's can be either in-person, individual, or group. The next group class is diabetes education follow-up classes, basically referred to as a conversation map class. And it's sort of, it's a more interactive, gets the patients involved more as a group into their diabetes treatment and collaborating with one another on the problems they've had taking care of their diabetes. It's basically usually confined to those folks who have already had the basic diabetes classes, and then they need more help to continue to improve their A1C. For those who have an A1C that's continuing over 9% or having challenges getting their target A1C, this would be the class to put them into. However, just that notation, that would not be the first choice. So the first choice would be the phone console to click on to get them into the basic classes. After the 4 classes that are run each Wednesday of the month for four Wednesdays in a row, and then they're offered a shared medical appointment at the end of the last class where they can interact with a diabetes provider to set a plan for the treatment of their diabetes. Inpatient diabetes education, this is for the floor nurses will participate in this, and this is a separate consult for those patients who are inpatient, are going to be soon to be discharged and need insulin pen or vial training, blood glucose monitoring training, or basic diabetes survival skills. So the floor nurses will have that available to them. They've been trained over the past couple of months with a great effort. One of our nurse practitioners, Diane Kernan, was busy with that with Bridget O'Sullivan, training the floor nurses, and did a great job with that. So they're able to do that. If you have an inpatient individual that needs to have blood glucose monitoring training or insulin pen training, vial training, basic skills, then you can press this tab for the inpatient nurse to do, and you can also put a order in the CPRS to remind the nurse to teach the patient for these skills. I thank you for your time, and I'd like to introduce Matt Mason is our next speaker. Thank you.
Thanks, Tim. Hi guys, my name is Matt Mason. I am a care coordinator in our home telehealth program. I wanted to introduce a little bit about what our telehealth program entails and let you guys know how you can get enrolled. And I'll do this by just covering the 5 W's. Pretty straightforward and simple. So first, again, my name's Matt. I'm a nurse. I've been here for 13 years, but our home telehealth team is comprised of 9 other nurses and a couple support staff, all who have been here a long time too. So you got a lot of experience in our program. Home telehealth has been active at Hines since 2007, but nationally as a program since 2003. But what do? We educate, case manage, and support patients and families with their chronic health illnesses. So we bridge the gap between the care at home and in the hospital. So we are in communication with the providers here at Hines and the patients, but also outside providers also. So this is done by giving goal-driven care. So during enrollment, we develop goals with you guys and on what you want to work with, but we review those in 6 months and decide if you want to continue with the program. It's always free of charge and participation is voluntary. So if a patient has a diagnosis of like hypertension, diabetes, CHF, congestive heart failure, some mental health illnesses like depression or PTSD, COPD, or chronic kidney disease, we can work with those kind of patients. How do we do this? We provide the patient, you guys, with some equipment. As long as you have a phone and you can communicate with us, we can work together, but we also use video visits too. So we don't necessarily have face-to-face visits, it's all over the phone, and you get to stay at home. So the patients use this equipment to send some data. It comes to us, the nurses, we review that and teach the patient how to consistently take that data appropriately. What does that data, what do those numbers mean? Discuss medication, signs and symptoms of those illnesses, and if they're getting worse, what to do. So we're ultimately aiming towards positive health behaviors, and when we see red flags, we alert the docs and let them know. So where you get to stay at home, and like I said, just use your phone. And if you're on Facebook right now, I have a feeling you're tech savvy enough to use our equipment, which is sweet, but ultimately that's not too much of an issue. We work with everybody to use the equipment we provide. And then at the end of the program, you get to keep some of the stuff to continue to monitor your own health at home. Why do we do this? We want to help keep our patients healthy. Out of the hospital, reduce ED visits. We want to bridge the gap with communication. So I teach a lot of patients how to use My Healthy Vet. and put the tools in their toolbox so they can ultimately use it when they move on from our program. Just a couple examples. One with diabetes, I picked up a new patient not too long ago. He had some new medications. We were able to meet on video. I showed him how to use his meds correctly, how to read food labels. They worked with pharmacy regularly too, so we forwarded data when needed, and then ultimately the patient's able to have reduced A1C and independence in his own care, confidence in his own care too. So another sort of example, like I got a patient who has had chronic health issues and unable to work. Being that some of his illnesses might have been service connected, I was able to help him get connected with the VSO, and he got service connection and is in a way better place overall. So ultimately, if you want to participate, you can let any one of your providers know, a nurse, social worker. You can call the hospital and say, I want to get connected to home telehealth, and drop your name and we'll look into it. We have a phone number for our office, 708-202-2850, but reach out and let us know if you guys are interested in participating. Thank you very much, and I'd like to introduce Victor next from Veterans Travel.
Thank you. Evening, everyone. I'd like to begin by confirming that the Traveling and Relocating Veteran Coordination Office is not part of beneficiary travel. I occasionally get confused because of the titles of the departments. I can't provide transportation or get your travel reimbursement started. But as always, if you call me, I'll make sure you get to the right people who can answer and take care of your concerns or questions. The Traveling Veteran Relocating Consult is designed to connect the clinical needs identified by a PCP or specialist of an assigned veteran to the available local resources while traveling. So the way the process begins is the PCP or specialist identifies a need and requests those services through a TVC consult. The consult's placed with the following necessary fields completed. The travel dates, when the veteran expects to leave and when they expect to be returning to the area. The location where the veteran will be. Sometimes I get consults that have identified a local VA. Those, unfortunately, may not be the right VA for the service being requested, so it's best to have the address of the veteran. It also sometimes gets referred out by the alternate or receiving VA facility to community care, and they need to have that veteran's complete address where they're going to be in the area so they can assign it to the appropriate provider under that service area contracted by them. The address, and then we need what the service is being requested. This can include imaging, labs, therapies such as OT, PT. The key point is you need one service line per TVC consult. So you can have labs on one, you can have imaging on another, but you can't combine 4 or 5 services into one consult because they don't go to the same areas. They'll go to all different departments. Same as if you were submitting consults within the Hines facilities. If specialty services are being requested, additional clinical data supporting that need should be attached to the consult. Most VAs, if not all, prefer that that data be included within the body of the consult and not as a comment as the end. So if you're referring to, let's say, orthopedics for knee arthritis and you want them to be seen by ortho, do you have some imaging that's more recent than the last 6 months? Most VAs will accept within 6 months imaging. Some occasionally say 30 days. It depends how things are going there. If you're referring to cardiology, then cardiac history. If they have a new complaint that the veteran has called you about while they're out of the state or out of the area, the receiving facilities, what we call the alternate VAs, will request that you've done some sort of preliminary evaluation of it, either through a VVC, or you can request through a traveling veteran consult that they be seen if it's more appropriate that another physician or independent practitioner lay hands on the veteran to examine what exactly they're requesting and what the need should properly be. If pre-screening testing is required, such as an MRI with contrast, I ask that you try and complete those questions just as you would here so that it expedites the flow. Occasionally they'll have an extra question or two, like in an MRI with contrast, and everything's about claustrophobia, exposures to metal industry, implants, those kinds of questions you would answer here. You should try and put those in the consult as well to speed up the process. If they have additional questions, I'll look within the chart, and if I can't locate it, then I'll reach out to the ordering provider to see if they have the data we need. Once the TVC consult is received, the coordinator, which may be myself or others who work within the office, will begin the process of coordinating the ordering. We'll contact the receiving or alternate TVC coordinator and work through their process to make sure that veteran gets whatever the requested services they need, or if it's not available, why it's not available, or what additional needs in terms of history or data they'll need to collect for the veteran. Community care, sometimes from here, a veteran may have received community care here for a particular service, but receiving community care at the alternate VA is not guaranteed. That's up to the alternate VA through their processes to evaluate if they can provide the service better in-house, or if the veteran should receive it in community care. And I know sometimes that's confusing, but it's up to the receiving VA whether or not they can continue community care. Thank you. Next coming up is the patient advocate, Candace Kent.
Good evening, everyone. My name is Candace Kent. I'm the Veteran Experience Officer here at Hines VA, and I'm here to discuss with you the amazing initiatives and programs we have here at Hines VA to keep the veteran and their families at the center of what we do. So the first initiative is the Employee Badge Backer Initiative. It is my hope that if you have got services here at Hines or just walk through the halls, you have seen our staff with their badge backers. These backers allow you to identify staff by their preferred name and also highlights their role here, allowing for a more informal connection to enhance the veteran experience. Next slide, please. And then we have Red Shirt Fridays. So Red Shirt Fridays are dedicated to our veterans, our future veterans, to come here at Hines VA, really recognizing our deployed service members and really kind of highlighting their service and efforts and really kind of championing them and supporting them until they all come back home. We encourage our staff, supporters, and veterans to wear their red shirts on Fridays to acknowledge those who are across the water fighting for our freedoms. Next slide. And then we have our Quiet at Night initiative. This is dedicated to our inpatient floors. This initiative allows you to receive some earplugs and also eye covers when you are inpatient floors, kind of recognizing that inpatient hospitals or stays can be noisy at times. And we want to ensure that all our veterans getting services here gets their rest. So with this initiative, we are amplifying and encouraging our staff to be a little bit quieter, and also our veterans who come visit to be a little bit quieter on the floors to ensure our heroes are getting the rest they need and leaving healthier than they came. Next slide. And then we have our patient committees. Our patient committees are constructed of veterans and family members working conjointly with our leadership here at Hines to really improve services at Hines VA. It's an opportunity to get your voice heard and also ensure that we are meeting the needs of our veterans and families here at Hines. If you are interested in, I encourage you to join and fill out the application, and I'll give you that information at the end of my presentation. Next slide. And then we have our veteran recognition wall. This is really highlighted or really put in place to highlight our amazing veterans here at Hines for all the things that you are doing. Again, our veterans are doing a lot of amazing things here. We want to recognize that within their service as military members, but also as community members, have done a lot in their community. So if you know someone who we should highlight, or if you are someone we should highlight, we encourage you to apply. Next slide. And then we have the Hines VA Starfish Award. This award is veteran facing and really encourages our veterans to speak up about the amazing care they're getting here at Hines. If you have been impacted or connected with a staff member here who has impacted your life or just made your visit or appointment better, we encourage you to really recognize those staff members so we can spotlight them here at Hines VA. Next slide. And then, of course, our surveys. As we know, we are always listening here at Hines, and we encourage our veterans and their family members to complete their surveys. We have 2 formal surveys here at Hines VA. Our first is our SHUP survey, and that survey is provided through the mail. It is usually provided to our veterans about a couple of weeks after their initial appointments, and we encourage our veterans to complete those surveys to get the feedback we need on how we can improve care or what we are doing very well. Additionally, we have the V-Sigma survey that comes via email. This is a little quicker and a shorter survey for our veterans, but we encourage you all to really complete that also to really highlight how your appointments are going here at Hines and what we can do better to improve your care. Next slide. And then Patient Experience Week is right around the corner. This is an opportunity to celebrate not only our veterans, but also our staff. This year's theme is gratitude. And so we want to thank our staff for all they do here at Hines VA to ensure we are providing great patient care. And so you should hear more about that in the next couple of days through our social media platforms. And next slide. And this is my information. As always, if you have any questions, concerns, or want to be part of some of the amazing initiatives I highlighted, I encourage you to just reach out to me via phone or email. We are happy to get you connected. And as always, thank you for choosing Hines VA. You could be anywhere else in the world, but you're right here with us. So thank you. Next up, we have Deputy Joseph Elena with the VA PD.
Thank you, Candace. Hello, everyone. And first of all, I'd like to thank you for the opportunity to speak at the Veterans Town Hall. I'm Deputy Chief Joseph Lena with the Hines Police Services here at our facility. I want to briefly speak on facility parking and some of the events that we're going to be hosting through Police Services. Police Services is expecting a busier than usual spring and summer time this year, over the last couple of years, due to not everyone being here, COVID, and some of the events that happened, especially for parking on facility. With that being said, Police Services asks all patients, visitors, staff to please park in legally marked parking spaces. Please do not park on curbs, roadway, grass areas of the facility. I would also like everyone to be mindful that the facility has signage posted throughout the facility that deems certain parking areas as reserved. Some to include would be handicap parking, permit areas, and motorcycle parking, just as some. Police Services is working with the facility leadership to have as much parking available to our veteran patients as possible. The facility is working on an upgrade to the parking lot signage to clearly identify patient and staff parking areas. With the extended daylight hours going into spring and summer, there will be additional people out and about on our facility grounds. So Police Services encourages veterans, visitors, and staff, if they see something that would be suspicious in nature, please report that to the police. See something, say something. As a community, it takes all of us to keep Team Hines safe. Next, I'd like to talk about some of the events and trainings that Police Services is going to be having here recently coming up. VA Police Services will be participating in the DEA National Drug Takeback program on April 26th from 10 a.m. to 2 p.m. and it will be in the north parking lot area. We'll have a tent set up to collect any unwanted prescription drugs that you would like to turn in. And that is open to everyone. Police Services will be hosting the National Police Week events as other years during the week of May 11th through May 17th. Two of the highlighted events that are open to everyone would be Coffee with a Cop on Monday, May 12th, and the Police Memorial Ceremony on Thursday, May 15th. Also that week, VA Police Services will be hosting crisis intervention training with our community partners on May 12th through May 16th. We are looking to bring back the police, fire, and military car show that we used to have pre-COVID. We're hoping for an estimated time for that event in June. We are going to host a large-scale facility active threat exercise with our community partners on July 12th. So please don't be alarmed if you see a large contingent of law enforcement on the facility. Don't be alarmed, it is training. It is one of the things that we do to stay active with our community partners. Police Services will also be hosting active threat training at our CBOC locations, but those dates have not been established as of yet. And then later in that time frame, we are looking to do the National Night Out event again that we hosted last year, but that would be later in October. Again, thank you everybody. That's the end of my presentation, and I would like to turn it over to Ms. Angelos Morris for closing remarks.
Thank you, Deputy Chief. All right, I would like to close by informing you all about upcoming events located on our campus. On April 16th from 11 a.m. to 2 p.m., our Amputation System of Care and Prosthetic Service will host a display in the atrium to raise awareness about limb loss and limb difference during Limb Loss and Limb Difference Awareness Month. All veterans are encouraged to swing by and receive information. Also on April 16th, that is National Healthcare Decisions Day. Social work staff will set up tables in our F lobby of Building 1 and the main lobby in the hospital of Building 200 to meet with veterans and discuss advanced care planning. I also encourage all veterans to participate in upcoming whole health offerings, including the Hines Healthy Living Community Garden plots, which you can see on the screen. If you would like to learn more about growing nutritious food, reducing stress, and improving your quality of life, please reach out to our whole health coordinator, Sheila Swan Guerrero, at 0720 or check out the flyer on the screen once again for more information. This year's Veteran Whole Health Fair is Thursday, April 17th, in the main lobby located on our campus from 9 a.m. to 1 p.m. Please come out to enjoy coffee and receive giveaways and learn more about our whole health resources. Lastly, mark your calendars for our 15th anniversary of the VA 2K Walk and Roll on May 21st from 10 a.m. to 2 p.m. The VA 2K is held annually to raise awareness for the Hines VA Healthcare for Homeless Veterans Program and to promote healthy, active lifestyles. Please consider joining us in donating items like hygiene, paper, cleaning, and laundry products. More information can be found on the flyer located on your screen. Thank you so much for joining us. We hope you can attend our next Veterans Town Hall, which will be on June 11th, 2025. Thank you all. Have a fantastic day.